Chapter 1, Perspectives on Maternal, Newborn, and Women's Health Care. Upon completion of the chapter, you will be able to characterize the key milestones in the evolution of childbirth in America, outline the major components, concepts, and influences associated with the nursing management of women and their families, compare the past definitions of health and illness with the current definitions, examine the factors that affect maternal, newborn, and women's health, evaluate how society and culture can influence the health of women and their families, distinguish the healthcare barriers affecting women and their families, and finally, review the ethical and legal issues that may arise when caring for women and their families. Factors affecting change in women's health care. The healthcare of women has changed over the years due in part to changes in childbirth methods, social trends, changes in healthcare system, and federal and state regulations. By reviewing historical events, nurses can gain a better understanding of the current and future status of maternal, newborn, and women's health nursing. If you look on page 7, box 1.1, it goes through the childbirth in America, a timeline, some of the changes. So starting in the 1700s, men did not attend births because it was considered indecent. Women faced birth not with joy and ecstasy, but with fear of death. Female midwives attended the majority of all births at home. And then the 1800s, there is a shift from using midwives to doctors among middle-class women. The word obstetrician was formed from Latin meaning to stand before. Puerperal or childbed fever was occurring in epidemic proportions. So a lot of women were having infection and were dying. The first cesarean section was performed in Boston in 1894. And the last one, the X-ray, was developed in 1895 and was used to assess pelvic size for the birthing purposes. Then in the 1900s, twilight sleep, a heavy dose of narcotics and amnesiacs was used on women during childbirth in the United States. The United States was 17 out of 20 nationwide in infant mortality, so that's not a good standing. 50 to 75% of all women gave birth in hospitals. Amniocentesis, which we'll talk about later, was first performed to assess fetal growth in 1966, so not that many years ago. And then in the 2000s, some of the things that changed: 1 in 3 women undergo a surgical birth or cesarean. Certified nurse midwives once again assist couples at home, in hospitals, or in freestanding birth facilities. Childbirth classes of every flavor abound in most communities. And according to the latest available data, the United States ranks 50th in the world in maternal deaths. And then the United States ranks 41st in the world in infant mortality rates. So those are some changes in childbirth trends over a timeline. Again, looking at more of the historical development of maternal and newborn nursing. In colonial America, childbirth was a difficult and dangerous experience. A lot of women back then actually died during childbirth. In the early 1900s, physician-assisted births, midwives for those who could not afford a doctor. So your middle to upper class women had doctors and often delivered in hospitals, while your lower socioeconomic status women, they had midwives and they typically delivered at home. In the 1950s, there was an introduction of natural childbirth practices. And currently, we have seen a trend in the return of midwives and doulas. Doulas are kind of like birth assistants. They help the laboring mom throughout her labor, things like that. Childbirth choices based on what works best for the mother, child, and the family. So there's a lot of input from the mom, the father, the baby, the family, and how the moms labor and birth will happen. So it's a good thing to include the patient and the family in on healthcare decisions. Core concepts of maternal and women's health nursing. Maternal, newborn, and women's health nursing provides evidence-based care to the client within the context of the family unit. This care involves the implementation of an interdisciplinary plan in a collaborative manner to ensure continuity of care that is cost effective, quality oriented, and outcome focused. It involves family centered, evidence based, case managed practice. Concepts of family centered care. Family centered care is the delivery of safe, satisfying, high quality health care that focuses on and adapts to the physical and psychosocial needs of the family. It is based on mutual trust and collaboration between the woman, her family, and the healthcare provider. The basic principles of family centered care as it relates to childbirth includes: childbirth is considered a normal, healthy event in the life of a family. Childbirth affects the entire family and relationships will change. And last, families are capable of making decisions about their own care if given adequate information and support. Focus of evidence-based nursing practice. Evidence-based nursing practice involves the use of research to establish a plan of care and to implement that care. This model of nursing practice includes the use of the best current evidence in making decisions about care. Evidence-based nursing practice involves the use of research to establish a plan of care and to implement that care. Widespread use of evidence-based practice may lead to a decrease in variation of care, while at the same time increasing the quality of that care that is given. So we know, and you're going to hear this all throughout your nursing career, EBP, evidence-based practice. We used to say, well, why do you do this in nursing? And we always would say, because it works. Well, we can't use that anymore. Now, when someone says, well, why do you do this in nursing? And now we can say, because we have evidence that supports why we put in a Foley catheter using sterile technique. So in nursing, you're going to have this evidence-based practice motto. And with nursing, we're going to use various resources to collect, interpret, integrate, and validate research-derived evidence for use in practice. So no longer will you hear nurses say, because we always did it that way, that's why we do it. Now you have to say, well, research shows that this is best practice. Components of case managed care. Modern healthcare focuses on an interdisciplinary plan of care designed to meet a client's physical, developmental, educational, spiritual, and psychosocial needs. This interdisciplinary collaborative type of care is termed case management, which is a process of assessment, planning, application, coordination, follow-up, and evaluation of the options and services required to meet an individual's health needs through communication and available resources to promote quality, cost-effective results. With our case management, nurses serve as advocates, so we speak on our client's behalf. The client is the focus. We use comprehensive care across the continuum, and we coordinate care with the interdisciplinary approach. So we don't just say, well, as a nurse, I know what's best for her. If she needs a diet consult, oh, I'm a nurse, I can do that. Well, of course, we can do nutrition consults, but we have dietitians. So we can incorporate the dietitian, we can incorporate the social worker if the mom needs certain things to help with her pregnancy. Does she need help getting her prenatal vitamins, things like that? So in nursing, we use a interdisciplinary approach where every team member helps within their role of specialty. Mortality rate. Mortality is the incidence or number of individuals who have died over a specific period. This statistic is presented as rates per 100,000 and is calculated from a sample of death certificates. When we're talking about women's health and neonates, we have certain definitions that we look at. We're going to talk about the maternal mortality rate, the fetal, the neonatal, and the infant mortality rate. So the maternal mortality rate is the annual number of female deaths from any cause related to or aggravated by pregnancy or its management, excluding accidental or incidental causes. During pregnancy and childbirth or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy, it is reported as a ratio of deaths per 100,000 live births for a specified year. My fetal mortality rate or fetal death rate refers to the spontaneous intrauterine death of a fetus at any time during pregnancy per 1,000 live births. Fetal deaths later in pregnancy, greater than 20 weeks gestation, are also referred to as stillbirths. Fetal mortality may be attributable to maternal factors such as malnutrition, disease, or preterm cervical dilation, or fetal factors such as chromosomal abnormalities or poor placental attachment. Fetal mortality is a major but often overlooked public health problem. This refers to spontaneous intrauterine death at any time during pregnancy. The fetal mortality rate in the United States is 6.2 per thousand live births, according to the CDC. The goal of Healthy People 2020 is to reduce the rate to 5.6 fetal deaths. The neonatal mortality rate is the number of infant deaths occurring in the first 28 days of life per 1,000 live births. The United States now ranks 41st in the world in terms of neonatal mortality, which is the death rate of infants less than 1 month old. The neonatal mortality rate is 4.5 per 1,000 live births. The goal of Healthy People 2020 is to reduce it to 4.1. Infant mortality rate is the number of deaths occurring in the first 12 months of life in 1,000 live births. Now we're going to focus on morbidity. Morbidity indicates a disease state or condition. Many women enter their pregnancy with a chronic medical disease, an infection or anemia, or engage in lifestyle habits such as smoking and drinking alcohol that are detrimental to the well-being of the fetus. Any or all of these can lead to a poor pregnancy outcome. So with this, we have no state has focused enough attention on preventative measures. Too many women lack health insurance coverage, which can be a barrier to getting prenatal care. No state has adequately addressed the issue of reproductive health and violence against women, so we're lacking in that. There is limited research on health conditions that primarily affect women or affect women differently. The Affordable Care Act, as well as Healthy People 2020, holds great promise for women's health with the emphasis on access to preventative health care. But as we know now, they're trying to overrule the Affordable Care Act. So we're just waiting to see what our federal government is going to come up with to help those who are not able to afford health care.